AIDS-free world by the year 2030. It's a vision that Jamaica shares with the world through the leadership of the United Nations.
The goal that was set by the UN and accepted by the global community is not out of reach, my friends, but it will take unprecedented levels of collaboration. All hands on deck. Government, communities, and the private sector. We will all have to band together to support this extraordinary push to end our epidemic at home.
The Jamaican government has long recognized stigma and discrimination to be a major barrier to HIV/AIDS prevention and treatment, as well as the care and support of people living with the disease. So the state has been working to address this and similar challenges such as gender inequality and gender-based violence by promoting greater equity, inclusivity, and human rights for all. Development of a workplace HIV policy, for example, sets out terms and conditions designed to ensure that every person living with AIDS is respected while trying to put a cap on transmission. An important component of the work is the building of leadership capacity at the community, district, and national levels. Increased awareness of the issues through continuous sensitization programs and improvements to the healthcare system is giving people with HIV/AIDS a new lease on life.
35 years ago, the world saw the first cases of what would grow to become the HIV/AIDS pandemic. In the 1980s, diagnosis equaled a death sentence. Today, people that are diagnosed with HIV/AIDS are able to live longer and, more importantly, to access necessary medicines and treatment.
In moving from a standalone HIV response, government has created a new integrated national HIV/STI sexual health policy and strategic plan. Service delivery has been integrated through the creation of the National Family Planning Board's Sexual Health Agency. That agency serves the needs of Jamaicans in a more comprehensive and efficient way, providing guidance, leadership, advocacy, and the implementation of quality, equitable sexual health education and services. It has the role of building social cohesion among people living with HIV and key population leaders, and enhancing the coordination of policies and programs across sectors. While the Caribbean region has the second highest HIV prevalence in the world, with Jamaica the highest prevalence among English-speaking Caribbean nations, the country has been making progress. The Ministry of Health's data reports an estimated 1.8% of adults ages 15 to 49 are living with HIV. This amounts to an estimated 32,000. Introduction of antiretroviral ARV drugs in Jamaica has resulted in HIV-positive persons receiving treatment and proper care, which allows them to live as long as someone without the virus. Deaths related to the disease have decreased by 43%, with treatment reaching that same percentage of persons infected with the disease. It is believed that if the country is able to treat all persons who are HIV infected, it could reduce the prevalence rate to almost zero by 2030.
From 2000 till now, you've halved the number of new infections, and also from the same year, you have come from 10% transmission of mother to child to 2%, which is almost getting there.
Once persons are treated and their viral load is undetectable, they are considered 90% less likely to transmit HIV compared to someone who is not treated.
If you are on therapy, you are protecting a partner by 96%. Even, higher than or closer to what a vaccine would do. So starting people on therapy is paramount. Starting people on therapy will help us prevent new infections.
A 2020 timeline has been adopted at the United Nations in a fast-track approach, which proposes to achieve some targets towards eliminating HIV/AIDS as a public health threat. Prevention, treatment, and stigma and discrimination are to be the areas of focus.
For the treatment component, we're inviting countries to achieve what we call the 90-90-90. That is identifying 90% of the infections, providing therapy for 90% of those who have been identified, and keeping with viral detection at 0 to the last 90%.
Abstinence and safe sex among young people are being promoted through sexual education. Sex education not only helps to prevent HIV and other sexually transmitted infections, but also supports other development matters, such as the prevention of teenage pregnancy.
In our work to put youth and adolescents at the heart of the HIV response, it is critical to recognize that the efforts, especially those channeled towards education, awareness, and personal responsibility, will ultimately translate to the development of individuals who are better equipped to make good decisions and positively contribute to their families, communities, and nation building.
Getting to 0 is everybody's business, a target we can reach by addressing the clinical, cultural, and behavioral attributes that fuel the prevalence of HIV and AIDS.